Hello, I'm Danielle. I'm a physical therapist in Hawaii, and today I'm going to discuss with you nerve root impingement. So, what is nerve root impingement? So, nerve root impingement is when you essentially hear your doctor say you have a pinched nerve. So, this is when a spinal nerve, I'm specifically talking about the neck today, when that nerve is pinched or compressed, therefore leading to irritation and pain. You may even notice that when you have this nerve root impingement, that you start to notice symptoms go down your arm. So you may notice that the pain is radiating down into your shoulder, even down into your elbow, or even into your fingers. And you may even have some numbness and tingling associated with this. So depending on where in your neck, which spinal level it's at, if it's in your upper cervical spine or your lower cervical spine, it can affect different areas of your hand, your elbow, your shoulder, depending on which is affected. So most often, the spinal level nerve root that's impinged or having the issue is usually lower on in your spine, therefore leading to problems usually into your hands. You may notice numbness and tingling into your pinky and your ring finger, or maybe even into your thumb and your pointer finger. No worries, physical therapy can help with this, and that's what I'm going to discuss with you today. So nerve root impingement essentially means there's compression or pressure on the nerve, as I stated before, and there's a multitude of factors that may cause this. So you may have been diagnosed with possibly stenosis or narrowing of the canal because of typically due to age or arthritis. You may have a bone spur. You may have a herniated nucleus pulposus or a disc herniation. Many of us hear about that. And the treatments can vary between the different diagnoses, but today I'm going to go over some more general ideas, some more general treatments or techniques or postures that are good for any of us that are having some type of nerve root impingement. As you know, there's not one answer for everybody. Everybody's not cookie cutter. There's not one recipe for a diagnosis, but there is some treatments that can be used for a wide range of symptoms, and that's what we'll review today. So what our goal is today is going to be to centralize your symptoms. So what it means when it means to centralize your symptoms is, let's say your symptoms are all the way into your hand. So you have numbness and tingling in your hand. We want to bring those symptoms up closer to where the area of the affected area. We want to bring those symptoms back to that spot. So peripheralization means it's shooting down or radiating more into your hands, your fingers, more numbness, tingling. With these exercises, I want you to evaluate, am I getting centralization of my pain? Is my pain or my radiating symptoms or my numbness and tingling moving more upward towards the neck? That's going to be our goal. That's what you want with these types of exercises. Then eventually we want to reduce that pain, right? So now you're probably wondering, well, Danielle, what can I do? What are some exercises or techniques that I can do to help reduce my symptoms for the time being? What can I do that will help me, be able to improve my function more? So, of course, there are a huge toolbox of options that you can do for this. Physical therapists, we have so many different techniques because, like I said, nobody's cookie cutter. But here's just a couple different things for you to start thinking about and to try, and then see if it helps. So what I first want to do is have you start to think about your posture, right? You hear posture. Well, it is really important, especially nowadays, as technology is increasing and as many of us are starting to participate more in desk jobs, use the computer, watch the television, we're beginning to have a posture, and I'm going to come to the side here, that looks more slumped, right? More rounded shoulders, a more forward head posture. And this is just putting us into a higher risk for having these types of symptoms or developing nerve root impingement or even just worsening our symptoms. So what I want you to do is try setting an alarm on your phone or try finding something that you do daily. So maybe every commercial break if you're watching TV, or every time you go to get up and get a drink of water, that you tell yourself to do some of these postural corrections. So what I'm going to recommend is first you'll start, if this is your normal posture here, sitting like this, what you're going to think about, and we're just going to focus on the upper body. Of course, I could do head to toe, but I want you to think about first is in the middle of your back, thinking about sitting more upright. And what you may want to do is put a pillow behind your back. This may help, develop that better posture, more upright, especially if you're going to be sitting here for a prolonged period of time. And then I want you to think about your shoulders. I want you to think about keeping them more rounded back. And then lastly is the exercise that we're going to implement, and that's what's called a chin tuck. So with a chin tuck, you can think about almost if you smelled something bad on your finger and you were tucking your chin back. It's not pretty, but it's retracting your neck back or tucking your neck back. And the goal of this is to improve your posture as well as to, like I mentioned before, centralize your symptoms. So I'm going to recommend you try doing these chin tucks, strengthening the front of your neck, which are called our deep cervical neck flexors, and work on doing these chin tucks. Just like I'm doing, making a double chin. And you don't want to think about it, leaning back. You don't want to just bend your head forward. It's going in almost directly opposed to your backward direction. So what I'm going to recommend you try is doing 10 repetitions for about a 10-second hold, and then reevaluate your symptoms. If this either improves your symptoms, centralizes them, or just provides a nice stretch in the back, try doing this, every hour, every 2 hours, and continue to reassess your symptoms. So next, what I'm going to recommend is oftentimes, like I said, you have this rounded shoulder posture. So you have a lot of tightness in what are called your pec muscles. So what you can do is go into a doorway and stretch out the pecs. Stretch out this pec major, this pec minor muscle to reduce your tendency to sit in this forward posture. So I'm going to move the camera and I'm going to show you one way to try this, okay? So you can see my doorway here. And what I'm going to do is place my arms on each side of the doorway. Place them where it's comfortable, and then you can put one foot in front of the other, and then you're just going to lean in. It may help to have the door open. Right now I don't, but you're going to hold this posture. Try this for 2 sets of 30 seconds. And then you should feel more of a stretch or relief in the front, decreasing the tension in those pec muscles. So this is good for any of us, but especially for those who need to work on their posture, or for those who may have some nerve root problems. So now that was mainly focused on posture. So now what I want to go over is something specific to nerve root impingement. So when it comes to nerve root impingement, what's happening is this nerve is getting compressed, therefore causing pain. So what you want to do is find a way to relieve the pain, to take some of that pressure off. So one thing that I found beneficial for my patients and can reduce some of that pressure is find a small towel or a long towel, but one that's somewhat thin, and then also one that can be rolled. And what you're going to do is you're going to twist it just about like this. You're going to place it within your neck region. Try to find the area that's a little bit more painful. Like I mentioned before, typically it's in our lower neck. So I'm going to go ahead and place it right around that lower neck portion. And what our goal with this is to provide traction. So cervical traction is going to be gapping, providing space and more opening for these spinal nerves, kind of giving them a relief, a sigh of relief for the nerves. So what you're going to try to do is almost on a 45-degree angle, due to the anatomical region of the cervical spine, pulling forward and upward on that neck, you're going to provide a little bit of relief. Hold it for about 10 seconds or so, and then relax. With this type of technique, you should feel immediate relief if it's going to be doing the proper job. Cervical traction should cause that decompression, and you should almost just feel a sigh of, wow, my pain is lessened, or I'm getting less pain or numbness and tingling in my hands and in my fingers. If that is something that you feel and it does reduce your symptoms, try doing this, holding it for about 10 to 15 seconds, whatever your arms are capable of doing, and try it for about 10 repetitions or so. You may want to do this, every couple hours or when your symptoms seem to really be bothering you. Now let's say one of your arms is really affected by this, so it's really happening in your right arm. What you can do is go ahead and hold it with just your one hand. Let's say you don't have the strength to do this, try asking a family member or friend, as long as they're nice and gentle and, not being too harsh on your neck. So these are just a couple ways that you can try to help your nerve root impingement, some home exercises that you can give a try. So again, we had the postural corrections, we had the chin tucks, the pec stretch, and then the cervical traction. Again, there's not one recipe for everybody, so of course seek out your physical therapist if you have any additional questions. Thank you for listening. Have a good day.